Welcome to RadiologyInfo.org. An abdominal ultrasound helps your doctor or healthcare provider diagnose the cause of symptoms such as abdominal pain or further investigate abnormal lab test results. An abdominal ultrasound can be used to look at the entire abdomen or a few different abdominal organs depending on your symptoms. This type of exam can help diagnose diseases of the liver, gallbladder, bile ducts, pancreas, spleen, kidneys, or bladder. Remember that your radiologist wrote this report for your healthcare provider. That can make it hard to understand. Some medical terms such as liver hemangioma or nephrolithiasis may sound scary, but may not be serious. Your provider can explain any findings mentioned in your report. Many of these findings are common and will cause you no harm. Sometimes your results may be available to you on an electronic patient portal before your provider has had time to discuss them with you. Keep this in mind and write down any questions you may have and talk to your provider. An abdominal ultrasound is typically done by a sonographer, also known as an ultrasound technologist. The technologist will press down with an ultrasound probe and may give you breathing instructions to help get good images. You may also be asked to fast before the exam, since gas in your bowel can often hide some abdominal organs. Your radiology report is divided into different sections: clinical history, technique, comparison, findings, and impression. Each section contains different information. The findings section lists what the radiologist saw on your exam. Findings may be normal, abnormal but not likely to cause problems, or abnormal and may impact your health. Keep in mind, some abnormal findings may not significantly impact your health. Sometimes the imaging test covers an area of the body, but the report does not list any findings, or may simply say unremarkable to indicate that it looks normal. For the liver, the radiologist will often comment on its echogenicity, or how well the tissue reflects the ultrasound wave. Also, they will comment on echotexture, which provides information on the composition of the liver tissue. These can help diagnose a normal liver or indicate possible liver disease, such as fatty liver or cirrhosis. For the gallbladder, things to look for include the presence or absence of gallstones and whether there are any signs of infection or inflammation. The bile ducts, which are closely associated with the liver and gallbladder, are often described as non-dilated or dilated. These can be normal or abnormal depending on your symptoms and surgical history. The pancreas is sometimes hard to see on ultrasound, and it's usually described as normal or abnormal in appearance. The spleen will be described as normal in size or enlarged. Sometimes normal extra spleen tissue will be seen and described as splenials. For the kidneys, the radiologist may describe the presence or absence of kidney stones and hydronephrosis, a condition in which the urinary tract is blocked and the kidneys are swollen with urine. The urinary bladder may also be evaluated, and the presence or absence of wall thickening or debris may be mentioned. The impression section summarizes all of the findings identified by the radiologist to help guide your doctor or healthcare provider in the next best steps for your care. There may be incidental or indeterminate findings that may lead the radiologist to recommend additional testing. Remember, your radiology report is written for your healthcare provider, and that can make it hard to understand. Write down any questions and concerns you may have and talk to your healthcare provider about any next steps. For more information about abdominal ultrasound, visit RadiologyInfo.org. Thank you.